let's talk about another question, which is basically you're 45 years old female patient who underwent thyroidectomy, and on the third day she developed perioral numbness. So your further investigation involved option A, free T3 T4, option B, calcium phosphate and the PTH level, option C, radioiodine uptake uh, scan, and the option D, that is T3 T4 and TSH. Okay, so let's talk about this question. So as we have already discussed few important things regarding the post-thyroidectomy complication, among them your hypocalcemic tetany is the one of the most important, and from the presentation that is there with a perioral numbness, which is the neurological manifestation of the hypocalcemia, we can easily able to understand that there might be a possibility of two things. One is your vascular injury to the parathyroid gland, another is the accidental removal of the parathyroid gland. That could be possible, right? Now let's try to understand. This parathyroid gland is basically, it's a two pair of gland which is basically related to the posterior posterolateral surface of the thyroid gland. Now this gland is basically forming parathyroid hormone, which is very much important in case of calcium and phosphate metabolism, right? Phosphate homeostasis as well. Now as a result of accidental injury, either it's a vascular or accidental removal of the gland, it might gonna leads to hypocalcemia. Now this hypocalcemia can present into in a varieties of way. Obviously your perioral numbness is the neurological manifestation. Apart from that, we have Chopstick sign and we have the carpopedal spasm, which is eventually known as the Trousseau sign. So in case of Chopstick sign, you have to tap just at the root of the facial nerve, just in front of the external ear. So that will eventually leads to clenching of the muscle of the facial expression. Okay, so there is a contraction of the muscle of the facial expression. Now this is known as the Chopstick sign. But we also have the Trousseau sign, which is basically if we can inflate or hyperinflate the BP cuff while looking into the blood pressure monitoring. If it goes beyond systolic blood pressure, mostly 20 millimeter Hg above than the systolic blood pressure, it might gonna precipitate carpopedal spasm in that case. Now the problem is that you can understand, so these are the two classical signs, but eventually the main risk is here, that is your laryngeal spasm or laryngeal tetany, that might gonna leads into airway compromise in that patient. So that might be a harmful for the patient. So we have to identify this thing very early so that we can intervene early, right, to save the patient. Now this perioral numbness mostly present at third day after the thyroidectomy operation, and it's a pretty much concerning symptoms as well. Now what should we do? Obviously we have to evaluate the parathyroid hormone level, the calcium level and the phosphate level in the blood, so that we can easily able to get our confirmation regarding the diagnosis. Okay, also these tests are also helpful because it will easily able to so this test, these are very much useful for us because it can also help us to evaluate the calcium level as well as the parathyroid level in the blood, so that we can proceed further. So for the treatment, what we can do is that we have to supplement for the calcium. So that could be either injectable, which is eventually the calcium gluconate, or it could be oral supplementation in that case. Okay, so that we can prevent the severe complication in such patient in a post-thyroidectomy hypoparathyroidism. Now regarding the other option, obviously there is a two option basically saying regarding the thyroid function test. So these options are here in this respect is not very much important, because a thyroid function test is not related with the hypocalcemia or the calcium metabolism in that case, as well as the radio iodine uptake therapy as well. Okay, so here your answer of this question would be option B, calcium, phosphate, and the PTH level. I think that would help you to get into your diagnosis.